We have oral site, rectal site, tympanic site, temporal site, and axillary site.
In oral temperature, we have normal degree 98.6. We need requirements for the temperature. We need probes. We need thermometer. We need
Pulse oximeter.
for oxygen circulation. We need hand sanitizer and tissue. So before you enter room, you need to wash your hands and sanitize your hands to prevent infection. Knock, knock, knock. Come in. Hi, ma'am. Good morning. My name is Amaka. I'm here to check your oral temperature. Is it okay?
Okay. pressure. Blood pressure is to check the baseline pressure of the patient. This is, you have to take note of the systole and diastole. And that is for the reading is mmHg, millimeter mercury. Okay? Make sure this is advised by the doctor. Before anything else, before start the procedure, you have to make sure you have the requirements. First, this one is a stethoscope. Okay, make sure it's working. The bell, the diaphragm, and the earpiece. This is the PP cuff. This is the valve. Make sure it's closed. And this one is the gauge. Make sure it's functional. And also, you have to wear gloves if necessary. Make sure you have some hand sanitizer and the wet wipes. Okay? And before entering the patient's room, make sure you have to do proper hand washing to prevent infection. Okay? So now, I'm going to enter my patient's room. CNA for tonight. How are you feeling? Are you sure? Okay. Ma'am, can I have your good name? Shula Michael John. Okay. Can I have your date of birth, ma'am?
22 April.
22 April. Okay, ma'am, before I'm here to take the blood pressure, but before that, I want to make sure that you had your food 30 minutes ago.
Yes, ma'am.
Okay. You've done any activities 30 minutes ago? Nothing. Okay, so you relax. Can I check once more your ID band? Thank you so much, ma'am. I want to ensure you that this will not cause you harm. Okay, I just want to check the BP. I will start now. So make sure you put your BP cuff properly. So make sure to locate the brachial pulse. Okay, with your 2 finger pads, you will locate your brachial pulse here and put the BP cuff 2 inches above the brachial pulse. Okay, and then you will fold the sleeve of the patient. Okay, ma'am. Not too tight, not too loose. Make sure you put this gauge properly. Okay, so you're ready. Make sure also you'll get the baseline. The baseline meaning that is the last sound. So we have to check the last sound. Okay, by pumping and add 30. So I'll start. Okay, it's 130 plus 30, so you have to start the baseline from 160, and now you will check by using your stethoscope. Make sure it's audible. Ready, ma'am? Up. 160 and slightly release until you get the systole.
So now you have the reading. You have to make sure you inform the nurse on duty.
Ma'am, thank you. We're done.
You will remove.
The normal BP for the adult is 120/80 millimeter mercury. So now it's done. Ma'am, is there anything you need? Just press the signal button. Okay, I'll come to you. Okay, and then after that, clean your table. Good night, ma'am.
Hello, my name is Monica Figueroa. I'm going to do pain assessment. As you know, in pain we have two kinds of pain. We have pressure pain and we have tolerance pain. Pressure pain is the pain that just started, just as it now. And as for tolerance pain, it's pain which has been there, but the patient cannot endure it anymore before seeking for relief. And in pain assessment, you need to know four things. One, you need to know the location of the pain. Two, you need to know the description of the pain. Three, you need to know the duration of the pain. And four, you need to know the rate of the pain. And in the rate of the pain, you have 1 to 3, it's mild pain. 4 to 6, it's moderate pain. 6 to 9, it's severe pain. And 10, it's the worst pain. What I need for pain in a pain assessment, I need a pen and my notebook. But before you go to the patient, you need to wash your hands so that you can prevent any infection. So I'll go to room 101 to the patient.
Come in.
Hello, ma'am. You just requested for assistance.
Yeah.
What's your name, ma'am?
My name is Gemma Escomo.
Okay, what's your date of birth?
May 15, I can say.
Okay, ma'am, can I see your name tag?
Okay.
How would you like me to address you?
You can call me Gemma.
Okay, ma'am. Are you in pain?
Yes.
Okay, can I know the location of the pain?
It's in my shoulder.
What's the duration of the pain? How long have you been feeling the pain?
No, I just feel it 30 minutes ago.
30 minutes ago. Can you describe for me the pain, Jima?
It's really radiating.
Radiating?
Yeah, and shooting pain.
And shooting pain? Okay. Ma'am, I'm going to tell you the rate scale of pain, okay? From 1 to 3, it's mild pain. From 4 to 6, it's moderate pain. And from 6 to 9, it's severe pain. And 10, it's the worst pain.
Okay, I have 9.
You have 9?
Yes.
So it's severe pain. Okay. Okay, that's severe pain. Okay, ma'am, I'm going to report this to my nurse on duty and will come and help you to release the pain, okay?
Okay, please.
Okay, thank you. Okay, when you are asked, when the patient is telling you, describing for you the pain, you need to take down everything. Then you go to the nurse and hand over. So I'll book the nurse and I'll tell the nurse I went to room 101. Patient named Gemma. She has shoulder pain. The location of the pain is shoulder. It has been going on for 30 minutes. The duration and the description of the pain, it's radiating and shooting pain. And the rate scale it's 9. So it's severe pain. So they'll go and check the patient. Thank you.
My name is Leia Carola, and I'm gonna show you on how to take the blood sugar. Taking blood sugar is important to determine if you are getting the target, if the patient is high blood or low blood, and it's also to avoid a long term of diabetic complication. And before we start, I will show you what are the equipment that we need to take the blood sugar. First, we need to have the glucometer, a lancet device, lancet, a strips, alcohol, and a gloves, and a swab alcohol. And tissue. First, I need to sanitize my hand to avoid the infection. And I will knock the door to see my patient.
Yes, sorry.
Good evening. need to ensure the privacy of the patient. I will close the curtain. And then, when did you last time that you take your food?
2 to 3 hours.
Okay, 2 to 3 hours ago. Okay, first, I will sanitize my hands again. I will prepare the Lancet device.
How to use the glucometer. First, twist to unlock lancing device. Insert the lancet and twist off the safety disc. Put back the cup and twist to lock.
This number is used, it depends on how, on what type of skins that you have. So I will adjust the number into 5. I will
Put on gloves if contact with blood, body fluids, secretion, or excretion is likely.
and then make sure the glucometer is working.
Insert the test strip to turn on the glucometer.
Okay. Inform the patient that before taking blood pressure that she can feel a little bit discomfort, but make sure that we will tell to her that it will not cause any harm to her. Okay, first, ma'am, Miss Shula, can I use your left hand to take your blood sugar?
Yes, ma'am. Your right hand.
Okay, right hand, that's okay, no problem. I will open the alcohol swab. Okay, I will use her middle finger to take her blood. Just relax na. You will feel a little bit discomfort.
Press the release button of the lancet to puncture the skin. Wipe off the first droplet of blood and squeeze another droplet of blood for testing.
I wipe it. And we need to take the second blood.
Put the droplet in the strip. The result will show in just a second.
Okay, your
The normal values of blood sugar is 80 to 120 milligram per deciliter.
is 99. We will wipe the blood. Your blood sugar is 99. Okay, I will record.
Remove the test strip from glucometer. To remove the needle, twist to unlock the cup. Press the used lancet into safety disc. Slide the ejector forward to remove the used lancet.
Then I will remove my gloves. Okay, ma'am. If you need anything, just press the button on your left side.
Dispose the lancet and test strip in a sharp container.